Good evening, Carl Springs, and welcome back to our Facebook Live Q&A. I'm joined here today by our medical director, Dr. Peter Antevi. We're going to answer some of the questions you have about COVID-19 and share some updates with you that we have here today. We've been working tirelessly with multiple meetings over the weekend, coordinating with all of our different partners, the Florida Department of Health, Broward County, the Florida Division of Emergency Management, and our healthcare providers like Dr. Antevi to my left. Here at the city, we're taking this very seriously, and we want to make sure that we can answer any questions that you have. So throughout this entire question and answer session, feel free to comment questions you have. We'll answer those, and we'll try to address those here today. Some actions that the city's taken since we last spoke here on Facebook Live. The city did declare a state of emergency. Our city commission held an emergency meeting last Friday to provide us with additional powers, some additional opportunities that we need in order to effectively respond to this emergency. So the state of emergency that our commission declared last week, that provides city staff with the opportunities to continue our preparations, procure needed supplies, and take actions necessary to protect our elderly population. Our concern with this virus continues to be our elderly population. It continues to be people who are in nursing homes, assisted living facilities, and folks with underlying health conditions that may be adversely impacted by this event. So with that, I'd like to welcome Dr. Peter Antevi, our medical director. Dr. Antevi, can you provide us with a little bit of information about what's occurred since our last Facebook question and answer, and also provide us a little bit more information about some symptoms and some steps that the public can take?
I will do that, Alex. Thank you very much. Good evening, everyone. From the last time we met and we had our Facebook conversation, I have to say that everything that we had mentioned in that last conversation still holds true today, meaning that the virus is out in our community. It's inevitable that many people will be exposed to this virus, except we need to perform mitigation strategies, which is what we're asking you to do. Social distancing, as you can see that we're far away from each other. We have just a couple of people here in the room today, if at all. And so the update from the medical aspects is that we're seeing, an increased number of cases where people are worried, which is understandable. We're seeing an increased number of cases where people want to be tested, and I want to go over those two items very specifically. You may feel like you have a sore throat, you may have a fever or a cough, but remember, those symptoms do not warrant a trip to the emergency department, because at the emergency department, they have very strict criteria of who can be tested at this point in time. And so if you're feeling symptoms, there's a number you can call from the city. You could also call your regular doctor, but we ask you to just not start going out and seeking care. We're going to give you that information, and as that information unfolds through the week, we'll give you more information to that effect.
And just to add on that, Dr. Antevi, there's two different numbers. There's a number from the Florida Department of Health that you will call if you have symptoms. That's a 954 number. That's a local number. And there's also a 800 number that is to call in for general information. That's a general call-in hotline. So we'll put that up on the screen, and if it's not up on the screen, we'll make sure that we put it in the comments so that all of you can see that information if you need it. In addition to that, our city's landing page, if you go to carlsprings.org, we're posting all of our most up-to-date information about COVID-19 as it becomes available to us. So that's a source of information that you can get outside of this Q&A, or maybe if you're watching this after the fact, you can go to carlsprings.org and you can get that information. We're also broadcasting this information on our city TV channel, so tune into our city TV channel on Bluestream, or again via the web at carlsprings.org to get information as it becomes available to us.
And Alex, I have a few more points, and I appreciate those numbers are important. As this progresses and more people get affected, we do want to make you understand that we're going to be having more call-in lines for people to call and get advice over the phone, because as this progresses, we understand that there's going to be a different process for people to get help, mainly by telephone first. Now, that being said, from the fire department's perspective, we have also instituted policies where if you call us and you have just mild symptoms, we have a policy in place where we're not going to transport you unless you fit certain criteria with these specific type of symptoms. And that's because, again, we don't want to overwhelm the system, and it's not appropriate to take an ambulance ride unless you're obviously very sick. One piece of information that's new, Alex, that people need to know, we're finding that people who have fever, body aches, but also GI symptoms, so nausea, vomiting, and especially diarrhea, this virus is also causing those type of symptoms as well. So that's something that people should be in tune to as well.
And I think that's important. We spoke about just general precautions that the public can take because we're not 100% sure, everything about this virus. It is a new virus. We're learning things as they progress. And so do you have any recommendations for folks at home? Listen, we talked about symptoms, runny nose, sore throat, fever above 100.3 degrees, but now you're also talking about gastrointestinal symptoms. So do you have any recommendations for folks, if you're feeling any type of symptom, you're under the weather, you think it's a sniffle, can you kind of share some tips for folks at home that they can take, even if this isn't COVID-19, for them to be prepared and a little bit safer?
Absolutely. I think that most of the symptoms that people will get, Alex, are symptoms, like you said, of upper respiratory infection. A majority of the people in the country, and what we've seen around the world, is that they get the symptoms that you can take care of with the over-the-counter cough and cold medications. And so, again, 99% of the population will have symptoms that we've all had many times before. The symptoms will come, and they'll go, and you'll be fine. As you mentioned earlier, the people that we're worried about are the elderly and those in nursing homes. So some other information that could go along the same lines, Alex, is that we're being told now that perhaps if you have a fever, you should use Tylenol instead of Motrin. That's the one kind of little piece of advice that the medical literature is coming out with. Perhaps Tylenol would be better. But again, use Tylenol, use over-the-counter cough and cold medications. Those are the things you do. At the same time, if you're concerned, you would call your physician and get advice from there.
Perfect. I really appreciate that. So we have a lot of questions, and I'll take the lead, and you can feel free to provide us a little bit more information. Some questions here about why are private schools closing? When are private schools closing, and why have public schools closed? Well, this has been an evolving issue, and I think that it's important for people at home to recognize that the facts are constantly changing and constantly, we're getting new information. So as folks like Dr. Antevi provide public officials with information, we're making decisions and we're acting upon that. So the school boards decided to close schools, and you'll see a lot of facilities that are associated with school boards, they did decide to close. Now, with this was a short week for public schools with a couple of days for teacher planning, with spring break coming up next week. So the decision was made to close those schools in an abundance of caution. I can't speak exactly to what private schools are doing, but we're all trying to follow guidance that's put out by the CDC, the Center for Disease Control, and we're trying to make decisions based upon those facts and figures. So we know that our younger population is not as susceptible to this from a severe case side. They can contract this virus, and they can be a vector for this virus. So by keeping them away from those situations where they can actually catch this and then spread it to loved ones that are older and maybe have those immunocompromised conditions or those underlying health concerns that are going to lead to those severe cases. Maybe you can talk, Dr. Antevi, we've heard the term flatten the curve. Mm-hmm. Can you explain that to our residents and what that means and how they're an important part of protecting our healthcare institutions?
Absolutely. I think that you hit it right on the head. The children are the vectors. So if the kids get it, they may be asymptomatic, meaning they have no symptoms or just mild symptoms, and they go and give it to all the adults in the community. If we get a lot of adults getting this infection very quickly, let's say in the next month, you're going to have a significant overwhelm of the hospitals and the medical care, the institutions we have here in our area. So all flattening the curve means is that we want to extend the amount of time it takes for the people in our area, all through the country, to actually get affected by this virus. Because again, they're predicting maybe even 100 million or more people will get it. So flattening the curve allows our medical establishments to not get overwhelmed with people. Emergency departments will get overrun. The ICUs, the numbers of ventilators. Again, these are with people who are elderly, people who have other medical issues are really the highest risk. And of course here in South Florida, that's a big part of our population. So the kids, I think correctly, were removed from school.
So it's it's good information that even though we are worried about this possible overwhelming of our healthcare system, the good news is that we can prevent that. If all of us take steps, social distancing, just like Dr. Antevi and I are 6 feet apart here, if we all take steps to help prevent the transmission and the spread of this disease, we can prevent that overwhelming of the hospital system. Washing your hands regularly. If you have to cough or sneeze, do it into your sleeve. Don't do it into your hands. Making sure that you're limiting your exposure in public areas, non-essential travel, non-essential outings can all be curtailed to help prevent that spread. And if we all take steps such as those that I just mentioned, we can prevent this overwhelming of the healthcare system. There's a question here from Nancy. How many cases do we have in Coral Springs? I want to take that, and you can provide a little bit more information as well, Dr. Antevi. I think it's important for people not to focus on how many numbers we have in Coral Springs, because likely if you come in contact with somebody who has this virus, they may not know they have it yet. They may not be showing those signs and symptoms. And so if we focus too much on where these cases are, or how many cases we have in Coral Springs, or how many cases we have in Fort Lauderdale, we're not going to really get to the crux of the issue. The crux of the issue is that this virus is projected to be everywhere, and it's important for all of us to take these steps to prevent it, because you're likely not going to know if you come in contact with somebody until you yourself show signs and symptoms. So at this point in time, we don't have information on confirmed cases in Coral Springs. Our paramedics, our fire rescue personnel do get alerted if somebody is showing signs and symptoms that may be COVID-19, but we have no way of knowing if that person has that disease. We don't know if that person's confirmed because they have to get tested, and in many cases it may just be the flu or another underlying health condition. So my recommendation to you is don't get too caught up on how many cases or where they're located. We really need to stress the importance of preventative measures across the region. Anything to add on that, Doctor?
Yeah, I would agree with you 100%. As the weeks go by, you should assume that it's all throughout the community. The number of cases that people are reporting out are just a fraction of the reality of the cases. And if you see our firefighters out there doing their job, which is a very difficult job to do, you will see that we are protecting them even against people who may not even have the symptoms, because it's our estimation that it's going to be throughout the community. And really the best treatment here is to stay away and to hunker down.
Perfect. So one of the questions I got is, why is there no toilet paper? Charlie asked that question. So, look, I think that everybody's taking this seriously. Everybody's stocking up in the event that they do need to self-quarantine or self-isolate. There's been a lot of questions about whether or not the city of Coral Springs is going to institute curfews or close businesses or things like that. I want to stress a couple of different points of how we make those determinations. We make those determinations based off of facts and guidance that's provided to the city from organizations such as the CDC, the Florida Department of Health, or the state of Florida. This is a fluid situation. As information becomes available to experts like Dr. Antevi, they provide those updates to the city, and then we take steps necessary to change things. So after this Facebook Q&A, we have another meeting with staff. We're going to work on some more recommendations, and the public can expect to see some changes in city posture. What those changes are exactly, we're still working on. But what I would urge the public to do is continue to stay tuned in, continue to stay up to date, because we are going to institute changes as they become necessary. So with that, to answer your question, why are there no supplies? People are stocking up. They're taking this seriously. I've seen people buying things that I don't really think are necessities at this point. But that's the short answer to that question.
I have a comment on that.
Yes.
I think most of you are probably looking to see what's going on around the world and are seeing kind of the progression of, it started in China and it's kind of moving its way across. And I think people are looking at what other countries are doing. And I would say that we're several weeks behind them. And I think people are just taking precautions to keep their families safe. And again, staying at home and having enough items at home to be okay for a couple weeks is a smart idea. Yeah.
Excellent. So a couple of questions that we had here. Folks had asked if we were having any changes to voting taking place tomorrow. As of right now, as I'm sitting here doing this Q&A, we do not have any information from the supervisor of elections that indicates that they will cancel early voting tomorrow. I know that a lot of folks already, mailed in their ballots and participated in early voting, so that's not an issue there. Another question that I think Dr. Antevi can provide us a little more information. Question: I've seen people in hazmat outfits around the city. Do we have cases in Carl Springs, and what does that mean? And perhaps you can provide us a little bit more information on what kinds of PPE our first responders are wearing when they respond to calls.
This is a great question, and I think it's important because when people see our folks kind of dressed out in what we call PPE, personal protective equipment, you may get nervous or scared. But let me just kind of assure you that those policies were put in place by myself and the leadership of the department because it turns out that without our first responders, our paramedics, our firefighters, our ED nurses, our ED physicians, everything comes to a halt. And our biggest concern is that if we get them exposed and they get infected, then all of a sudden we end up with, instead of having the number of people we have here at the department, that begins to shrink down. And we've seen that in places like Seattle. We've seen it throughout, for example, in places like Israel, where there's 1,000 doctors in quarantine. And so we know that's coming, and so we've taken extra precautions at this city to help our EMS professionals out there do the job that they can do. And so if you call us for a non-infectious problem, we may still take extra precaution because of what Alex said earlier, that this virus sometimes doesn't present classically. You could have someone who doesn't have symptoms. And so we are taking extra precautions and trying to preserve our medical ability to help all the citizens of Coral Springs and Parkland. And we're also trying not to infect others, such as those in the nursing home. So the nursing homes have been essentially locked down. Lockdown meaning we don't want people who are not essential being in there, and all the people who are in those nursing homes need to be protected from the people who are helping them, the healthcare workers. So that's kind of a long-winded answer, but I think it's pretty important for everyone to understand why we're doing that.
So I had a couple of comments here that I was hoping you could answer. We had a couple questions about in Italy and France, they found that people who had taken ibuprofen, it activated the virus. I have another question asking what medicines recommended to give for fever. And I was hoping that you could give a little bit more guidance on some of the over-counter medicines you take if maybe you have a milder case or you feel regular flu-like symptoms coming on.
It's great. I love that people are keeping know that detail, which is great. So if you take ibuprofen, which is Motrin, Advil, Aleve, that kind of family of medications, the suspicion, again, it hasn't been proven, but this is it's still early. Those medications allow a certain enzyme called ACE2 to be expressed on the cell. They think that COVID-19 needs ACE2 to enter into the cell. And so if you take Motrin, not Tylenol, Motrin, Aleve, any of the ibuprofen type medications, you're going to increase that enzyme. So if possible, stay away from Motrin, Aleve, Advil, those types of things, and take Tylenol instead. Acetaminophen is what we would recommend that you take. There are other medications that are out there that have been reported as well. I'm not going to get into all the different details here, but if you happen to have high blood pressure or diabetes, it turns out that you may be on a medication that will increase that enzyme as well. So as the information comes out, we will continue to give it to you. But again, the people who have those issues, type 2 diabetes, if you have obesity, you're an increased risk, smoker, increased risk, hypertension, stay at home, quarantine yourselves, stay out of the public, and don't let the kids come over.
Thank you, Doctor. So a couple of questions here. Are parks closing? Will they be available for children? At this point in time, the City of Coral Springs is not closing our parks. Our parks do remain open. Once again, we ask residents to be patient. This is a fluid situation. As we get more information, we're going to make adjustments as necessary. So please stay tuned. We will be putting out additional information later tonight concerning some of our city facilities, concerning some of our parks, and we'll provide that clarification to residents later tonight. Should gym, restaurants, bars, and other places that attract crowds of over 50 close down? And we've saw this action take place on the West Coast in a couple states on the East Coast, and the CDC guidance is recommending crowds of less than 50 or more, and we saw in the President's press conference this afternoon, they're recommending crowds of less than 10. At this point in time, the City of Carl Springs is not recommending, and we're not mandating that any businesses close down. We ask the public to, use caution. We urge you to use common sense and keep these tips, about you. If you don't need to go out, if you don't need that unnecessary interaction, then we recommend you don't do it, particularly for those groups and those demographics of folks that Dr. Antebi just talked about that are at an increased risk to contract this and have complications from this virus. A question here, I'm in my 40s and I have diabetes. Should I be worried? Can you talk a little bit more about that, Dr. Antebi?
Sure. The answer is yes. If you have any comorbid condition, meaning, again, high blood pressure, diabetes, you're a smoker, obesity is another one, again, we mentioned earlier, you are unfortunately at risk because that enzyme, ACE2 enzyme, has an increased expression in people with diabetes. And that's just what the literature is telling us. And this is new information. We're looking into it very heavily, and I have a lot of resources, at my discretion that I'm really getting this information. This is new information. Some people are saying it's good information. Other people are doubting it. But I would say that if you're in that category, you should take extra precaution. It's what I've told my family. That's what I would tell your family as well.
Thank you, Dr. Antebi. A couple questions here. Will Carl Springs be placed under a curfew? At this time, the City of Carl Springs is not under a curfew. I want to address the state of emergency that our City Commission prudently signed last Friday. That state of emergency enables our city staff to move quickly, to take necessary actions to prepare our city, prepare our staff, and protect our elderly population. As part of that, state of emergency in the past for things like hurricanes, we have issued a curfew. For this emergency, we don't see that as a need at this time. But like I said, we're going to continue to evaluate the situation as additional information is provided to us from experts such as Dr. Antebi. Staff will make those determinations and will provide that information to residents as soon as we have it. The best source of information from the city continues to be our website, www.carlsprings.org, or by going onto our city's social media platforms such as Facebook, Instagram, or other social media platforms like Nextdoor. We'll share that information with you. If we have essential information, we will also use our Everbridge text to opt-in options. We'll place a graphic up on the screen. We'll provide some information. You can text Alert CS to 888-777, and that will opt you in for emergency alerts from the City of Carl Springs. That's another avenue we have to us. We've closed schools. Are public parks still open? And if so, how are they being cleaned? That's another question that just came in. Our public parks do remain open. Our parks are cleaned on their regular cleaning schedule. We encourage people that if you are playing on the playground, bring sanitizing wipes, clean that equipment down before you use it, clean it down after you use it for the folks after you, and continue to wash your hands and take normal steps that we recommend it. Really, personal hygiene is key with this, making sure that you're keeping up on your own cleanliness, you're well rested, you're taking steps needed to keep your immune system up is going to be key in this virus. And another question we have in here, are there cases in Parkland? Once again, we discussed this a little bit earlier. Please do not preoccupy yourself with where these cases are located. Likely, if you are to come in contact with somebody who has this virus, you're not going to know it when you come in contact with them. So please make sure you're being judicious, you're taking steps needed to keep yourself up to date, and you're making sure. So, and a correction earlier on our text to opt-in, I said alert Carl Springs. The correct word is actually just to text Carl Springs to 888-777. So if you text Carl Springs, all one word, to 888-777, that is our text to opt-in to get emergency alerts, reference COVID-19 in the future. Another question for you, Dr. Antebi. Do we know if this virus is airborne at this time?
That's a great question. There's been speculation that the virus is airborne, and the leading infectious disease kind of resource that we use in the country gentleman by the name of Michael Osterholm out of Minnesota, who runs a very large agency. We were on a webinar with him several weeks ago, and he says that by the way that the virus has moved throughout the world, he thinks that invariably it is airborne. And what does that mean? It means that if you're in an enclosed room and someone's coughing up all over the room, that those particles are kind of just somewhere in the air. And if you walk into that room in a very small room, then you may have a chance of getting exposed. The other term you've heard is droplet. Droplet means that the particles are not so minuscule that they can stay airborne, but that they fall onto the countertops. And the only way to get infected is to touch the countertop and then touch your face or your nose and so forth. I'm of the belief that if you're in a small area and people are coughing up, that it is in the air. Many of the experts that I know feel the same way, but I think that gives us an additional reason to do the social distancing, stay away from people. Now, if you're outside, Alex, and you're in a very open area, as long as you stay like the distance we are away from each other, 6 feet away, then the air is not going to contain enough viral particles to get inside of you. But if you go into a room, a home, then I think you're more at risk. And so that's why this virus is coming, and it's going to spread to a lot of people.
And so I appreciate that. And with that, I'm looking at some of the questions coming in. I do want to reiterate, the city of Carl Springs, we do not have confirmation if there are confirmed cases here in the city. That is information that's kept by the Florida Department of Health. That is not something that's shared with city staff. So I know a lot of people are wondering if there's cases in Carl Springs. We just don't know. We're also getting another couple questions here about drive-through testing sites. So we did see a couple news articles that came out yesterday. They did open a drive-through testing site down in Miramar at the Memorial Healthcare System. And we also received information just before this Facebook Q&A that there is a drive-through testing site at the Cleveland Clinic location here in Carl Springs. Now, I want to reiterate to folks that this is not open to the public. This is not something that you can just drive through and say, hey, I'd like to get tested to see if I have this. You have to have been prescribed a test by a doctor. So if you are going to that drive-through testing site and you have not been ordered to do so by your doctor, you will be turned away. You are not able to get that test. So if you are showing signs and symptoms, we recommend that you call that call-in number, which will be posted here on our screen, and include it in the comments. You will talk to your healthcare provider, and at that time, if your healthcare provider deems it necessary, at that point in time, you will be directed where to go if, in fact, it's deemed necessary for you to have that test. A couple questions for you, Dr. Antevi. We had questions once again about thyroid issues, diabetes, different medications. I know you've discussed some of these already. Are there any other underlying health conditions that the public should be aware of, and any precautions that you would recommend them to take in the event that they do have these underlying conditions or they're at risk to contract this virus?
Yes, I would say that if you're, per our protocols, if you're over the age of 50, we would actually be more concerned. If you have, again, diabetes, if you have, unfortunately, cancer, severe asthma, really any of these types of issues where you're on multiple medications every single day, all those issues, right? There's not one more than the other, but what we do know is that if your immune system has taken a hit in any way, and that's why they're over 50, because we know that as we get older, our immune systems aren't as sharp as they used to be. So age alone, and then any illness or any issue that you're dealing with personally will put yourself at risk. And I personally, Alex, have a number of family members who are in that position. I told them the same exact thing: hunker down, stay home, don't let anyone expose you. And I would say this, that if anyone's like my family, where we have the need for people to come in and help because it turns out that my father needs help. We're even limiting the number of people who can come in and help every day because we know that's the source. So if you have someone at home who's helping you or helping your loved one, your mother, your father, your grandmother, grandfather, I would make them take very strict precautions, hand washing, and even go as far as making them wear even perhaps a mask while they're at the house, because we know they're the people who are going to bring it to you. And unfortunately, like my dad, we need the help, and we just got to be very careful.
I appreciate that. A few questions we've gotten here about supermarkets. Questions about if the city's going to limit the amount of people going into supermarkets. If another suggestion was to have a specified time for senior citizens to go shop. At this point in time, the city of Carl Springs does not have the authority to determine how many people are going to be in Publix right now. We're asking people to, look out for your neighbor, be a good neighbor, be nice, be friendly to people. As far as the supermarket hour for senior citizens, that's not something that's been instituted. If you have a senior citizen on your block or you have somebody that you know in your family, help them get the supplies so that they don't have to be out in those locations. Take the steps that Dr. Antevi just mentioned. If you're caring for someone who's a senior citizen, take those extra steps to make sure that you're not transmitting that virus and help them to get those supplies they need. Another question we had in here, will pools stay open? Once again, at this time, all of our facilities are open in the city of Carl Springs. We will be making some decisions later tonight. We will be communicating additional decisions out to the public later tonight. And questions about the DMV, about other public facilities, I don't know that answer off the top of my head. That information is available on the internet through Broward County's website as well as the Division of Motor Vehicles website. But I would urge the public continue to stay on top of this because this is an evolving issue. And as a city government, I know the county and state government, we're making these decisions as we get more information from experts like Dr. Antevi. So we're going to continue to work on that. Dr. Antevi, with that, we're getting additional questions about symptoms. If someone's having a sinus issue, stuffy nose, chronic cough, should they get tested?
Okay, so that's a great question. The CDC has put out the ability for us to screen who needs to be tested and who doesn't need to be tested. If you simply have a cough, that doesn't qualify you as getting a test at this point. You could have, again, body aches. That's not going to qualify you. So there are a certain set of criteria that you must kind of qualify for to get tested. And so all the people are at home who are saying, I have a little cough, sore throat, runny nose, and Lord knows I've gotten a lot of those phone calls. To each and every person, I've told them that there's no need for testing at this time. Now, again, if their age is a little is older, or if they have any comorbid conditions, I may think differently about that. But at this time, the answer is no, and just stay at home, self-quarantine, talk to your doctor, call and get advice. Now, if you're having difficulty breathing, shortness of breath, you're feeling unwell, then that's a whole different story, right? I'm talking about we're taking the mild symptoms are over here, and then the symptoms where the infection is in what we call the lower respiratory tract. That's a different story altogether.
And so we had a question from Cam asking about the criteria for the test and prescription. I think you answered that pretty well.
I have it. I can read it if you like.
I think that the public would definitely appreciate that information.
Okay. And I had it ready to go because I knew we were going to get to this. Okay. So what I'm reading off here is right from the Department of Health. This is the Florida Department of Health. So a person has to have had close contact with a laboratory-confirmed COVID-19 patient. So if you're living with someone who has COVID-19 or close to someone, then that's qualification number one. The person is part of an outbreak of suspected COVID-19. So like we saw in New Rochelle in New York, where the entire synagogue and a lot of those people got infected, that's considered an outbreak region. Those people are having nurses that were sent to their home by the Department of Health there and testing them each one by one. The third one is there someone who has been hospitalized with an unexplained respiratory illness? And so if you get to the hospital and you have an unexplained illness and you have to be admitted to the hospital, you'll get a test. And then the very last one is a person who traveled to or from an affected geographic area, Italy as an example, Spain, Iran, China, with widespread community transmission and has fever or symptoms of lower respiratory illness. And those are the four qualifications. So you can see here, Alex, that the question that was asked earlier about some congestion and stuffy nose, doesn't qualify at this time. Now, those criteria may change, and when they do, we will change our policy here locally.
And just to reiterate, those drive-through testing sites that were advertised on the news, you have to be experiencing these symptoms. A doctor has to go through those symptoms with you and actually prescribe you a test in order to get that. So I just want to reiterate to the public not to drive through those testing sites. You're not going to be given a test if you show up there. A quick question here. Can we spread it to pets, and can pets spread it to us? What's known about that, doctor?
I've heard some conflicting reports. I heard that the dog can get it, and someone told me the dog can get it. I mean, I treat humans, so I don't know the answer. Maybe we'll get our veterinarian here next time. But I'll have to get back to you on that, because I've heard conflicting results.
And I think, too, with that, just good hygiene, continuing to make sure that if you're petting your dog, you're washing your hands before you eat, you're not touching your face. I think that, our citizens can continue to practice those good practices, and that'll hopefully help to quell any spread as we learn more and more information. Another question here, what are we doing to keep law enforcement officers safe? We had a question earlier about people in hazmat suits. We're not sending folks out in hazmat suits. We're not sending police officers out. But what you will see is police officers wearing personal protective equipment. You'll see them wearing an N95 mask or comparable. And what that is meant to do is it's meant to protect them from inhaling and being exposed to this virus. The reason that we're doing that, and the reason that they're wearing that on any calls where there's suspected flu-like symptoms, is so that they can continue to protect the rest of the public and serve our residents safely. We don't want our police officers being exposed to this virus and then being home sick. We want them healthy so that they can continue to serve and protect us as they do each and every day. A question, for you, Dr. Antevi. Andy asked, what about churches and places of worship? What advice do you have for those types of congregations?
I think that they shouldn't happen. Honestly, that any social gathering needs to stop, and I think that, especially if you think about the type of people who may go to a church, it could be younger, combined with people who are older. I think that those areas are just a hotbed for transmission, and if we want to keep this curve, as we said, flat, we need to stop everything, and the precedence has been set. There have been many places around here locally and also around the country and around the world that had just shut down any kind of holy gathering place.
And I have one more question here for you, Doctor. Women who are pregnant, do we have any evidence of how this may affect their pregnancy or affect their baby?
I can tell you this. There has been some reports of women who have delivered babies. Apparently, when the woman was COVID-19 positive and the babies were delivered, that were fine. And then I heard a news report today that there was a younger child, an infant, who was positive for COVID-19. I would say that if you're pregnant, then I would be very careful with who you're around. If you have any other sick people around you, you should take extra precaution. So there is good news on the pregnancy side, but if you're asking me, I would say stay away, keep yourself protected from others, and don't go out and about if you don't have to.
Thank you for that. So I do want to wrap this up tonight. I want to thank everyone for joining in, especially Dr. Antevi for taking your time out of your day to be here and answer questions. You can continue to ask questions on this feed. Our public information office will continue to answer any questions you post here. And also it helps us at the city. If you have questions, we work on getting answers for those. So if we don't have an answer right this minute, we'll work on it and get back to you. I would encourage our residents to continue to stay in tune with our city. Once again, carlsprings.org provides all of our information. You could also continue to follow us on our social media on our social media links, all of our pages. We'll provide those updates. City staff does have another meeting tonight, and we will be providing additional updates as decisions are made. Thank you once again for joining us.